Previously, I said Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Syarifudin. I am from Electromedical Engineering, Politeknik Kesehatan, Kementerian Kesehatan. In here, I will review or I will present about the ECG. What is the ECG? ECG is one uh, diagnostic device, and he the function to record the heart in a human for use to we know about the health of the heart. Uh, why we should to know about the ECG? Because heart disease is the one of all disease can die someone in the world. Heart disease can influence structure and function of heart and caused by various factors.
In Indonesia, one of the cardiovascular diseases that continuously sustains in the first order is coronary heart disease. According to the sample registration system surveying the coronary heart disease, mortality rate is 20% of all deaths. As need ECG is not only used by hospitals but is also needed by medical personnel in disadvantaged areas, borders, and islands to have health service which accidentally. Electrocardiogram or ECG is a biomedical device that functions as a monitoring heartbeat from heart signal, and I will briefly explain the system. Plug the diagram on ECG tool. First, the heart signal is the patient is detected using electrodes that are attached to the patient in the right hand, left foot, and right foot. Second, in the processing block, the heart signal is detected using the instrumentation circuit, and a signal buffer is carried off outside a buffer circuit so that the text signal is an actual signal and no signal is added. The signal will be just shunt alternately, switching using a multiplexer to select the signal to be tapped. Instrumentation output will be filtered by using a passive filter will seswi fall. The frequency fall of heart signal is also amplified. Furthermore, the output will be adjusted to the reference value of that can be read by microcontroller using adhere circuit so that no signal data is cut off or lost. And the adhere circuit or output will be transferred to the microcontroller via the ADC port, which is the launch from analog to digital data. The ECG will then be processed on Arduino. Then the filtering will be implementation. And third, data has been filtered digital will be a grab of ECG signal on the TFT LCD or PC.
And then I will show you how we use the ECG.
The training programme is aimed at healthcare professionals who have been asked by the line manager to perform a 12-lead ECG in their diagnostic area. Part 1 of this programme is the podcast. This will aim to demonstrate how to perform a 12-lead ECG with accurate limb and chest lead placements. Part 2 is hands-on experience, which will be organised by a line manager or through the induction process. Part 3 will be an observational assessment in which, when you are successful, you will receive a certificate to take away with you. Your equipment must be kept clean and well maintained at all times in accordance with trust policy and infection control. Before you perform an ECG, you must also adhere to the trust hand washing policy. Before you perform an ECG, you must make sure that the battery is fully charged. The battery icon on this ECG machine shows what will happen when the battery is not fully charged. It is important that you check that the correct date and time is also present on your ECG machine. It is important that you check the standard settings on your ECG machine before you use it. These are the paper speed, which is 25 millimeters per second. It is a calibration, which is 10 millivolts, and it is the filter, which is 150 Hz. You must also check the patient's details with the patient, which includes the name, the hospital number and the date of birth. This may be the use of an alcohol wipe, an abrasive pad or a razor. The ECG you're about to see demonstrated is in accordance to all national guideline standards. Limb leads are placed both on the ankle and the wrist. Precordial chest positions are very specific. V1 is placed in the 4th intercostal space close to the right sternal border. V2 is placed in the 4th intercostal space on the left sternal border. V4 is placed in the mid-clavicular line in the 5th intercostal space. V3 is placed midway between V2 and V4. V5 is placed anterior axillary line on a horizontal line with V4. V6 is placed mid-axillary line horizontal to both V4 and V5. Once the ECG leads are placed in the correct position, wait for the trace to settle so there is no muscle artifact or baseline sway. Then press the record button. Once you are happy with your ECG recording, disconnect the leads and remove the electrodes. Clean your equipment and then pass your ECG to the requesting clinician.
And the end of the presentation, I will say sorry when I was wrong my word and I was wrong my sentence. I say so sorry and I say wassalamualaikum warahmatullahi wabarakatuh.